Hi, this is Dr. Johnny Nelson at the Bone and Joint Surgery Clinic, and I wanted to make this video and talk a little bit about what a shoulder arthroscopy or a shoulder scope procedure actually is. So arthroscopy or a scope procedure is a surgery. It's a surgery that is mainly performed by orthopedic surgeons such as myself, and especially in the shoulder, it's a very useful newer technology. It was developed and mainly kind of caught on in the 90s and in the late 80s. But as time goes, our indications for doing shoulder scope surgeries are really expanding and including more and more things. So I do shoulder scope procedures. I also do this in the wrist and in the elbow as well, but this video is about shoulder scope surgeries. So what is a shoulder scope, or a shoulder arthroscopy as it's also called? So I have a model of a shoulder joint here, and I want to kind of show you what this is. Basically, a scope surgery or an arthroscopy is always a way of looking inside a joint. Mainly a joint usually is where we're looking. And instead of using a standard open incision, it's going to be using a series of instruments that are thin, usually about the size of a pencil, and inserted into that joint through a variety of poke incisions. Usually in the shoulder, there's incision in the back, there's incisions in the front, and little poke incisions on the side as well. So that's what a shoulder scope procedure is, and it should be distinguished from a standard open orthopedic surgery. So a standard open surgery where we actually make an incision in the skin that's long, and the goal of that incision is to be able to open up so that we can see with our own eyes what exactly we're doing in there. So a shoulder scope is different in that we're actually putting a camera into that little poke incision, and I'm not actually looking with my own eyes into the joint or what I'm looking at. I'm actually looking at a camera that's off to the side, and the camera is on the very end of that little pencil-sized instrument. Now the benefits of shoulder arthroscopy or shoulder scope procedures are really huge. It's a technique that was really adapted and developed in the late 80s, early 90s. People started doing it as early as the 70s, but as time goes on, our skills, our techniques, our understanding of these procedures, our technology gets better and better, and we do more and more things through a scope that before we were doing with open surgery. But why do a scope procedure? What's the benefit of a scope procedure? So mainly the main thing is that it's less invasive. When we're doing a surgery, and especially on the shoulder, for things like rotator cuff problems, biceps problems, labral problems, instability, we want as surgeons to accomplish our goal, which is to treat the symptoms and treat the pathology, the tear, whatever it may be. We want to accomplish that goal, but we want to be targeted about it. We want to do only what we need to do and have minimum what we call innocent bystanders, meaning we want to have a less invasive surgery and less secondary or unintentional consequences of that surgery, right? So think about it. If you're making an open incision on the shoulder to open things up and look at it, that's a great way of actually repairing things and fixing things. However, you have innocent bystanders, which are the skin, the muscular layers that you open, the fascia, which is the envelope around the muscle. All these things you have to cut through, and basically you have to injure them, because remember, surgery is a controlled injury. That's really all it is. And so when you're doing surgery, you're doing, your body sees that as an injury. And so if we have ways of treating problems and addressing those problems and fixing those problems without having those innocent bystanders, we're going to adopt those methods and use those whenever we can. So the other thing about shoulder scope procedures is I can see so much better, and this lowers the risk for the patient. So as opposed to open surgeries, right? Scope surgeries, the way that it works is we actually fill up the joint with fluid. We actually have a little machine that pumps fluid into the joint and actually blows it up like a balloon, not filled with air, but filled with fluid. And because of that, I can see things so much better. I can see the rotator cuff, I can see how torn it is, I can see blood vessels, I see nerves, I see fat, I see muscle, in ways that if we did it through an open surgery where obviously you would have bleeding, we can't see quite as well. So I can see things much better, and that actually makes things much safer for you in terms of the overall risks. So things like infection are much less common with shoulder scope procedures than with open procedures. Nerve and blood vessel damage is much less common with those things. So it's a safer procedure for patients. The other thing about shoulder scope procedures is that they're also outpatient most of the time. as opposed to big open surgeries in the shoulder, where sometimes patients need to stay overnight just to monitor them due to blood loss reasons and the increased anesthesia requirements. Shoulder scope procedures are almost always outpatient, meaning that you go to where you're going to have your surgery, and by the time you're done with the surgery, you get discharged home, and you'll be sleeping in your own bed and at home that night. So you won't have to stay in the hospital overnight. So very briefly, I want to go over exactly with shoulder scope procedures what we do. And I kind of lump it into 5 different things, right? So in the shoulder joint, and I have a model here, there's basically 5 different things that I can do with the shoulder joint. Number 1, labral or lip problems. So the joint, the actual socket part of the ball and socket joint here, is surrounded by a little lip, right? And patients can have problems where the lip tears. It either causes pain or instability, meaning a loose shoulder joint. And shoulder scope procedures are perfectly suited to addressing tears and problems with that lip. The other thing is rotator cuff problems. So the rotator cuff is basically a cuff, right? So that's actually what it is, of muscles that attaches the shoulder blade, which you see here, to the upper arm bone. So consider it like a little cuff of muscles that goes through and on top of the shoulder blade and kind of wraps around the ball here. And rotator cuff, I'm sure you've heard of tears of the rotator cuff, but shoulder scope procedures are perfectly suited to repairing rotator cuff tears. So that's the second thing, rotator cuff. Number 3 would be bone spurs. So patients in this roof bone of the shoulder, so you see this is called the acromion, and it's the roof bone of the shoulder. Patients often will have a big bone spur that we have that hangs down here. Now in most patients that's not a problem, but sometimes what happens, and especially if the shoulder blade gets really stiff, that shoulder bone can hit up against that bone spur, right? And sometimes what we need to do as surgeons is actually go in there and with the scope surgery, shave down that bone spur on the underside. That's called a decompression or an acromioplasty. That's basically the third thing that can be done in the shoulder. Number 4 would be the biceps. So the biceps, and we actually have a special little groove here in our shoulders. You see that little groove coming through here? The biceps tendon, or the biceps muscle, which is down here, actually goes up and splits and turns into a long stringy tendon that goes into the shoulder joint here. And that biceps tendon is commonly involved. It's what we call a bad actor in the shoulder. It's commonly involved with pain and instability in the shoulder. And often when we do shoulder surgery, we have to address that biceps tendon. And shoulder scope surgeries are perfect for addressing that biceps tendon. We do something called a tendonitis, so that's often performed. The final thing is the clavicle, right? So the clavicle is a collarbone. It's actually not part of this model, but it comes up here. And actually there's a little joint here called your AC joint. You may have heard of an AC joint or shoulder separation before. And it actually comes up here, and there's a little joint that the collarbone has with the roof bone. And through a scope, we can actually go in there and take out part of the end of the collarbone. And that's more rarely done through a scope, but certainly something that I do with frequency through a scope to take out bone spurs that are at the end of that collarbone. So that's 5 different things that we can address in a nutshell. There's some different things that we also do, but less frequently, but the 5 main things: shoulder lip or labral problems, rotator cuff problems, biceps problems, that bone spur under the roof bone, and then the AC joint. Now, depending on what you have going on, you may only have 1 or 2 of those things addressed during a shoulder scope procedure. You may have all 5. So it really kind of depends on what we find with your imaging, your physical exam, what's causing your pain. So hopefully this video is helpful to describe what a shoulder scope procedure is, how it's different from other open procedures, and the benefits of having a shoulder scope surgery as opposed to a big open surgery. So thank you for your time, and hopefully this video was helpful for you. If you have any other questions, you want to learn more, visit my YouTube channel or go to RaleighUpperX.com to learn more about my practice in shoulder and upper extremity surgery. Thank you.